Pharmacological agonist and antagonist of histaminic receptors. There are a lot of histaminic H1 receptor agonist. The well known is histamine and beta histidine. Beta histine is available in the market under trade name in Pakistan under trade name SARC. This is the only beneficial agonist of H1 receptor. When histamine bind here with H1 receptor, this one H1 receptor is GQ coupled. It's interacting with alpha Q. For the complete discussion of GQ receptor, please go back to my video lectures on drug receptors. So this interact with GQ, this alpha Q, after phosphorylating, interacting, stimulating phospholipase C. This phospholipase C then hydrolyzing PIP2, and this PIP2 is hydrolyzed into IP3 and DAG. इधर और भी इंट्रासेलुलर सिग्नलिंग है, लेकिन both stimulating kinase protein enzyme. When both stimulate kinase protein enzyme, there are a lot of pathways further from after the stimulation of kinase protein. For example, number one, this stimulated kinase protein phosphorylating calcium channel and calcium influx occur. This calcium influx increasing calcium inside the cell. Now this increased calcium may directly act on the smooth muscle and cause contraction, bronchial contraction, and this bronchial contraction may be responsible for cough. And this contraction is also producing anxiety, diarrhea. These increased calcium level due to this influx may accelerating the exocytosis of neurotransmitter. This increased release of neurotransmitter may create increased alertness, insomnia, and these neurotransmitter may interact with chemoreceptor trigger zone CTZ, and this further interact with vomiting center, and there is vomiting. This protein kinase may also activating the production of EDRF, endothelial derived relaxing factors. These EDRF producing nitric oxide after action with the nitric oxide synthase, and this NO producing dilation of the capillaries, especially in the brain stem and labyrinth of the air. So this dilation decreasing vertigo, and this is the beneficial action of histidine. When beta histine when bind here as agonist, after these intracellular signaling, reducing vertigo. But beta histidine, this beta histine also, this beta histine beneficial in decreasing vertigo, along with other side effect. Bronchoconstriction may create GIT upset, it may create even MSS. So these are the related side effect whether this beta histine. This protein kinase may also create special protein synthesis through transcriptional factor. For example, number one protein is aquaporins, which increasing body secretion, and number two is abnormal protein. These abnormal protein reacting with antibodies and producing allergic reaction. This allergic reaction creating itching, urticaria, pain, inflammation. So this is the one of the beneficial agonist for H1 receptor. There is no beneficial agonist for H2 receptor when H2 receptor are stimulated by just histamine interacting with alpha S, gamma S, beta S, stimulating adenylyl cyclase, converting ATP into CAMP. CAMP again stimulating protein kinase A, and all these activities are possible for this intracellular signaling along with special protein, and these special protein are in the form of proton pumps, and this proton pumps in the GIT stomach and increasing HCl.